Millions of Americans are still under an air quality alert in the northern U.S. that is coming from wildfires in Canada. The National Weather Service says smoke from the wildfires will continue to flow from the upper Great Lakes to the northeastern region of the country. Several major cities in the U.S. were blanketed with haze this week, including Chicago, Detroit, and New York. The smog prompted beach closures in Illinois and the cancellation of a soccer tournament in Minnesota. Now, the air quality is also a concern for this Sunday's World Cup final match outside of New York City for fans and competitors.
We've got athletes who are playing at the top of their game, and then they're having to deal with these environmental risks that can impact their playing. I don't think that they're going to be able to play with N95 masks, which is what we would normally recommend. So I think just trying to really optimize their respiratory health and doing anything they can to maintain their breathing status.
Well, health experts urge fans attending the final to mask up and hydrate. It also goes for anyone who has to be outside in affected areas this weekend. They also recommend people move most of their activities indoors to avoid respiratory risks.
A warning now from health experts as air quality alerts go up for more than 100 million people in the U.S.
The alerts are due to smoke sweeping across many parts of the country, as we just mentioned, from nearly 3,500 fires in Canada and northern Minnesota. Mandy Gaither has more on the impact wildfire smoke can have on your body and ways to lower the risk.
The wildfires may be a ways away, but the EPA says smoke can travel hundreds of miles and impact air quality and the health of people far from the fires. Pair that with extreme heat, and it's a potentially dangerous combination.
It can have a serious impact on cardiovascular health, and we're talking anything from a heart attack to a stroke to increasing your risk for a heart failure exacerbation.
Dr. Elena Lewis with Northwestern Medicine says that combo can also trigger cardiac arrest in people with underlying conditions. Those at increased risk of complications include people with asthma, COPD, high blood pressure, high cholesterol, diabetes, those with a diagnosed heart condition, a history of stroke, congestive heart failure, or certain types of irregular heart rhythms. But Lewis says you can lower the risk.
Knowing what your risk factors are, knowing if you're susceptible, knowing if you do have a heart condition, and as much as is possible, especially on days like today, I would stay inside as much as you can.
If you do go out, Lewis says to wear a mask or N95 to help filter some of the pollutants and stay hydrated. She says dehydration can make you even more susceptible with the humidity. And for those with asthma, take prescribed inhalers with you. If you feel any of these persistent symptoms, chest discomfort, shortness of breath, a racing heart, extreme perspiration, nausea, or if something just doesn't feel right, seek medical help.
Don't ignore it, because could be a really dangerous time right now.
For Health Minute, I'm Mandy Gaither.
The CDC says you can check the air quality in your area by plugging in your zip code on airnow.gov. You can also sign up for email alerts and be notified about the air quality around you.